The agenda is sponsored by Newcastle County Government.
This week, we're going to speak with Senator Sarah McBride in her home district of Bellevue, Bellefonte section, North Wilmington. We're going to discuss human capital and how to retain it. Hi, I'm Kerwin Gaines, and welcome to the agenda. How do we compete globally? How do we compete with other countries in regards to retaining human capital? Well, we're missing a big piece, and that's family medical leave. We have to assure the people, the worker, that they're not going to lose their job if in fact a life event occurs. Well, we're going to discuss that more with Senator Sarah McBride. State Senator McBride, how are you? Welcome to the agenda.
I'm good. It's great to be here with you.
You were on the top of the list of people that my boss, the main man Ivan, told me that I needed to speak with if I was ever going to make a hit out of this show.
Well, I am honored to be here, and honestly, anyone who's friends with Ivan is good in my book.
It is a good thing to be friends with Ivan. Trust me, it's a good thing to be friends with Ivan. So we are here. We started off in the lovely town of Bellefonte, and now we're in, I guess, a block or so away in Bellevue. And this is your district.
This is my district. We're at the Bellevue Community Center.
Oh, great.
Just attached to Mount Pleasant Elementary School. It's a great spot where the community comes together weekly, monthly for gatherings. It's just a great place that really reflects this area of my wonderful district so well, because it's really a place where families come together.
And your district's broad. It goes all the way to Wilmington.
Wilmington all the way up to the Pennsylvania state line in Claymont.
Wow. And you said even here there are weekly farmers markets and all those things?
Yeah, they have weekly farmers markets here. There's a community garden just over to my right. Once a month they have huge farmers markets. In fact, I was recently here for a Halloween costume farmers market contest where we had to grade and decide winners for a bunch of young people in costumes.
Not a bad job.
Well, I will tell you, probably the worst thing for an elected official to do is try to pick winners among their constituents,
especially
and particularly kids. So I feel like we probably lost more votes than anything else.
Well, speaking of votes, you have a couple things going on right now down in the House. Tell us a little bit about that.
Sure. So, I think as I have seen throughout my time in the state Senate, as I saw during the course of my campaign, one of the biggest needs for Delaware is to keep and retain more young people and young families in our state. It's really what makes this community here in Bellefonte such an energetic, exciting, diverse area.
And it's our future.
It's our future, right? And we need to attract and keep more young people here for the workforce, for the tax base, to make sure that we're putting Delaware on a long-term, successful path for growth and economic development. And so, for me, one of the big issues that I'm really passionate about is paid family and medical leave. Because I believe that in order to attract and retain that young talent, we need to bring down the costs facing young families. And more than anything else right now, what I hear when I come to the farmers market here, what I hear when I was going knocking on doors during the campaign, was that the cost for childcare, the cost for pre-K, the cost when you have that child in those first few months, that those costs are really burying families right now. And if we can build out a cradle-to-career support system for families that brings down costs and improves outcomes for young people, we can attract those families here. We can keep those families here. And paid family and medical leave, it doesn't just include the newborn child. It also includes if you yourself are diagnosed with an illness. It includes if you're helping to care for an elderly parent who's struggling through a serious illness. It includes all of those human needs that we have. And I think it's a critical part of building out that support system to not just do what's right, but to attract those young families here so that we can put Delaware on that long-term path to success.
Now, I love the bill and how you're moving forward, but how does that work back with the Build Back Better bill?
Oh, it's a great question.
Are they in parallel with one another?
You hit the nail on the head, and one of the things that I have been tracking very closely is the progress of President Biden's Build Back Better Act, which, as you allude to, includes investments in birth through 5 support systems like paid family and medical leave, early childhood education, because I think President Biden knows what we as elected officials here locally in Delaware know, which is that families are concerned with this, that families need help, that families need support. And so we're tracking the progress there. And one of the things that I did after I introduced Senate Bill 1, the Healthy Delaware Families Act, that would provide 12 weeks of paid leave to Delaware workers, was when the president decided to move forward, I said, I'm going to put my bill on hold to see what the federal government does.
Right.
And whether Congress acts or whether the state has to act, Delaware families can't go without this life-saving benefit any longer. And I'm hopeful that President Biden's package will not only pass, but it will pass with all of those different components included within it.
So do I.
and families across our state and across our country do. And I think what I'm committed to is to ensure that, one, we make sure that as many families as possible can access those benefits that hopefully President Biden will pass, that will fill holes if there are any, and that will build on that historic investment in families so that Delaware can compete, because what President Biden's going to do is he's going to raise the floor, right? And so we're going to have to do even better to attract those families here. So we're going to have to build on that progress no matter what happens.
So, and someone tracking this, is it safe to say, correct me if I'm wrong, that you're almost running a parachute in case it doesn't get passed, in case there is an issue? Will your legislation still go through and kind of follow up just for Delawareans?
Yeah, what we'll do is when it passes, we'll see what that final law looks like.
Okay.
And there will likely be areas that we can, holes that we can fill.
Gotcha.
There'll likely be ways that we can complement it, and there'll be ways that we can build on it. It's going to depend on what the final package looks like, but they are absolutely complementary packages running concurrently. And of course, we want to see what comes from Washington, but we're going to have to act no matter what. It's just the question is, what will the details be based on what happens in Washington?
Thank you for the clarification on that. Now, we're also talking about telemedicine.
Yeah.
And tell me a little bit about that.
So I think one of the silver linings of the last year and a half is that we've had to reimagine so much of our lives, how we work, how we have fun, how we connect, how we deliver healthcare. A lot of that hopefully will go by the wayside as we can come back together in person. We all obviously have seen over the last 2 years that human desire to connect in person. But there are some lessons learned from those new ways of doing things. And one of the lessons learned was that the future of healthcare delivery includes expanded access to telehealth. And you know, that can sound like a not particularly exciting issue, but it's
a necessity at times.
It's a necessity, and it has a transformational impact for so many Delawareans. Because when we're talking about barriers to healthcare, we can't just talk about health insurance. We also have to talk about the time that it takes to get to the doctor's office, the time that you have to take off from work to get somewhere.
And our ability to do that, where that may not be the case in every family.
Exactly. There's so many working people who don't have even access to paid sick time, paid days off, in order to go to that doctor's appointment, in order to drive up to Philadelphia for that cancer consultation. There's obviously Delawareans with disabilities who face real mobility challenges when it comes to getting to a physical doctor's office. So this past year, the legislature passed, I was proud to be the Senate prime sponsor of legislation dramatically expanding telehealth here in Delaware to really remove those barriers for folks living in rural communities, for working families, for Delawareans with disabilities, to make healthcare more and truly accessible in this state.
So how does that correlate also with mental health as well?
Yes, absolutely. We're really trying to expand it for the full range of services, because one of the things that the pandemic has also deepened is the mental health crisis facing so many people in our communities. We've seen the impact of that with the opioid epidemic. We've seen the impact of that on our young people who are already facing a mental health crisis, but even more so today. And so breaking down those barriers to mental health care is a critical part of that, because mental health care is fundamental healthcare. It's a necessary part of our healthcare delivery system to keep people healthy and on a path to success.
So I don't want to talk also all day about what you're doing now, right? What are the plans moving forward? What are some other things that are out there that you have on your agenda?
Sure. Well, I think there are so many different issues that we need to tackle here in Delaware. Some of the things that I'm really excited to be working on moving forward is wanting to help to facilitate Delaware's transition to electric vehicles. This is going to be one of the most transformative changes in our economy.
Senator McBride, you're talking to a gas lover here, okay? I enjoy the sound of a V8 and all the. You're going to really have to sell me on the electric vehicle.
So I don't have to sell you, because the reality is the industry is going to make us all go there. GM, Chrysler, they've all said in 10 to 15 years, every vehicle will be electric, either hybrid or totally electric. And so we're all going to have to adapt to this. I don't yet own an electric vehicle, I'll be totally honest, because it's not a truly accessible option at this point. One of the challenges with electric vehicles is the amount of time it takes to charge the electric vehicle. So the industry is moving in this direction. And if we as a state don't prepare for that transition, what will literally be the most significant disruption in a industry or a market in our society since the advent of the internet itself, if we don't prepare for that, then we're going to be scrambling in 10 or 15 years.
And that kind of goes against everything that the president is talking about as far as infrastructure and having that global advantage that we just don't currently possess in regards to our infrastructure and how things run in our country.
That's right. And if we don't build out that infrastructure, if we don't think thoughtfully about how to make electric vehicles work in our communities, particularly for folks who live in more urban, densely populated areas where they don't have on-property parking, for new home building to make sure that it's more EV ready than what we've constructed in the past.
Good point.
If we don't do that, then we're not going to be ready when that shift inevitably occurs, because electric vehicles, it's no longer ideological, it's imminent and it's inevitable.
Let DART do the driving. DART First State provides transportation that is clean, safe, reliable, and affordable. Plan your trip and get real-time bus information with the free DART Transit app. Scan your phone to pay your fare with the free DART Pass app. So what are you waiting for? Try transit today. Visit dartfirststate.com or call 1-800-652-DART.
Auto accident, medical negligence, work injury. Contact Team Tice, your Delaware personal injury lawyers. Leroy Tice in Wilmington, Delaware, serving and supporting the people of Delaware. Call 302-489-2400. That's 302-489-2400. Online at teamtice.com.
This message is brought to you by Newcastle County Government.
Many wonder, what is a variant? A variant is a mutation or a change in the genetic sequence of the virus. Some of our methods of treating COVID-19 become ineffective. If we were to simply get vaccinated, we could decrease the spread and the likelihood that a mutation would form in the first place. Let's get vaccinated.
Next up, we're going to speak to Miss Elena Tidwell from AAA Delaware. Headquarters are right here in Wilmington. We're going to talk about the rising cost of fuel, almost $4 a gallon this week. Well, are we going to have to transition to hybrid? Senator McBride thinks it's inevitable. Is it cyclical? Is it seasonal? We don't know. We're going to sit down with Miss Tidwell and she's going to break it all down for us. Hello, Ms. Tidwell.
Hello, how are you?
Great. So, AAA, we're fortunate enough to have the headquarters of AAA right here in Delaware. A lot of people don't know that. We shared stories about AAA's past versus where it is now off camera, but it is still a very important factor in the lives of everyone, whether they know it or not. And right now, one of the things that AAA does, and does very well, is track fuel trends, right? Because it affects drivers. It affects people and businesses and moving merchandise and everything that we're doing now. So right now, as everyone is well aware, there is a spike. Gas prices are just out of control, in my opinion, right? Tell us a little bit more about that. Your opinion, AAA's opinion, and their findings.
Well, AAA has tracked trends and historical gas prices for many years. And I can tell you that currently gas prices, not just here in Delaware, but across the country, are at the highest levels that they've been since 2014. So it's been 7 years since we've seen gas prices here in Delaware as high as they are right now, above the $2.35 per gallon mark. And we're seeing lots of states across the country that have crossed over that $3.50 per gallon threshold.
Mm-hmm. I have friends that sent pictures about their gas prices in Washington State, and they are just absolutely ridiculous. I don't want to say ridiculous, right? So they're more than what we're used to seeing now. That being said, we're coming out of a pandemic. I'm claiming that we're coming out of this. So How does that correlate to gas prices? There's more people on the road now. People are accepting the fact that there's more vaccines in arms, so they can get out. So some people are actually returning back to work. Does that correlate into this somehow? Absolutely.
What people need to remember is this time last year, gasoline prices were more than $1 less per gallon than they are right now. Mm-hmm. Crude oil was trading at half the price that it is right now. And that's because we were at the height of a pandemic. The vaccine was not available. People were staying home. They weren't traveling. They weren't visiting. They were working remotely. They were doing school remotely. So demand for gasoline and crude oil dropped significantly in 2020 due to COVID-19. So now we're seeing, fast forward a year later, as you mentioned, vaccines are in arms. People are feeling more comfortable. They're feeling safe to return to as close to normal as they can. People are returning to the workplace in person, whether full-time or hybrid. People are returning to school full-time in person. People are returning to travel, to vacations, as we saw this past summer. People are looking ahead to the holiday travel season, and they're booking flights, or they are planning their road trip to be with family and friends, because we couldn't do that last year. We couldn't do it safely, as we were told by the CDC. So all of those factors translate to one thing: an increase in demand.
This is the big thing, right? The big question: what are we going to do about electric vehicles? They seem like they're on the horizon. I spoke to a Delaware senator last week, and she made it very clear to me that, Kerwin, electric is coming. I told her about my love for V8s, and I enjoy all of that, and it's coming, right? So it seems like when the oil gas is at the pump is almost at $5 now, I don't have a choice but to go to a Tesla dealership or a Ford dealership or whatever and begin to really look at an electric vehicle. Is it just the writing on the wall, you think?
Electric vehicles are coming, and they've come a long way since their inception, but we're looking at needing that infrastructure to be able to support a mass fleet of electric vehicles across the country, as well as consumer education. What do the new electric vehicles look like? What does today's electric vehicle look like? It's very different from what EVs looked like 10 years ago. And I think a lot of people are still stuck 10 years ago in terms of what that electric vehicle was. You could only get but so many miles before you had to recharge. It wasn't a practical vehicle to take on what we know as the Great American Road Trip. But EVs have changed, and you can take those EVs on road trips now. But it's that public education that we need to see begin to ramp up again in terms of how you can replace your gasoline-powered vehicle with an electric vehicle. That is the wave of the future, but it's going to take time because we have a massive fleet of gasoline-powered vehicles, and people tend to hold on to their vehicles for quite some time. Over 11 years is what the average person spends in terms of holding on to that vehicle. So many people don't have that luxury of just buying the new electric vehicles that are out there, the new autonomous vehicles that are out there. They want to wait and see. They want to get the most that they can out of the investment that they already have with their gasoline-powered vehicle.
Yeah, and I think it's ironic maybe that Tesla and Hertz came up with an agreement this week that Hertz is going to purchase a tremendous amount of cars to replenish their fleet, and they will be electric vehicles that we're now renting on our trips or going to the airport, and in your community you'll be seeing a lot more of them.
And that's exactly how the electric vehicle is going to replace the gasoline fleet that we have now. You'll start to see the rental car agencies replacing their fleet. You'll start to see local communities, townships, counties, states replacing their fleet vehicles with electric powered vehicles. And that's how consumer education begins. That's how that word of mouth begins. That's how people will rent a vehicle and give it, a test drive, test driving that electric vehicle when they go to rent a car in the future. That will give people that hands-on experience with an electric vehicle and perhaps sway their decision when it comes to upgrading their current vehicle.
And you made it a very good point from an infrastructure standpoint. Okay, so now we're going through Congress and the U.S. Congress. We're trying to push through the infrastructure bill, and you're probably aware of that. We, as a country, have to be prepared for this, right? Our grid has to be prepared for this.
Sure.
Charging stations are great. You can see them at Wawa, you can see them at the mall and other locations, but other than that, you really you don't see them. So we have to begin to prepare as a country for that.
We need that infrastructure so that people feel confident and safe, quite honestly, on the roads with their electric vehicles. The same way we would punch into a GPS, where's the closest gas station? Where's the closest charging station if you're not returning to your home that night? If you are on a weekend getaway, if you're on vacation, where do you go? Because we do see those charging stations at many gasoline stations, convenience stores today. But are they at every gas station? No, they're not. So again, it's that public education. How far are the modern EVs getting you? How do you begin to look at what the infrastructure looks like? Where can you get that charge when you're on the road? And the infrastructure will grow as the fleet grows, and that will take some time. It's not a switch that's going to be flipped overnight. We're not looking at a deadline at the end of any year you might want to mention. It's going to be a slow, gradual, steady process.
I'm really passionate about making sure that our criminal justice system more fully works for every Delawarean. And so there are some reforms that we're considering in the legislature, including amending the Law Enforcement Bill of Rights to make sure that we're no longer dead last in the country when it comes to transparency with law enforcement, to improve and increase public trust within our law enforcement. I'm really passionate about making sure that we're upholding the highest standards of ethics in government. And so I'll be introducing legislation that ensures that official misconduct, which is currently a misdemeanor, that's essentially the charge for abuse of power, that actually reflects sometimes the severity of that official misconduct. If you're just charged with a misdemeanor here in Delaware, you're not disqualified from public office. We saw that in Newport with a former police officer who was fired from his job and charged with official misconduct, found guilty of official misconduct because he tampered with evidence, was recently just elected to the town council.
The police chief.
The former police chief. Right. And the Supreme Court has said, because official misconduct's just a misdemeanor, that person's allowed to serve. But I think that fundamentally undermines the public trust in our elected officials.
Good issue. What pushback are you getting from that? Are police unions on your side when it comes to this? Are officers on the road on your side when it comes to this? What's the temperature out there?
So, I mean, what we're talking about are people who have committed and been found guilty of official misconduct, right? So law enforcement wants to make sure that we're supporting the good apples, and they want to make sure that we punish the bad apples. And so if a person, including law enforcement or an elected official, has been charged and found guilty with abuse of power, I think it's pretty clear that we shouldn't be entrusting them either to remain in or allow them to serve in a position of public trust where they have access to those types of resources, funds, and power. And so this isn't just about law enforcement, it's about government writ large, to make sure that we're truly building a government that has the integrity and ethics that I think the people demand.
Okay, so again, police unions, are they on your side when it comes to this?
We're still having so we haven't yet introduced the bill, and we're going to be talking with different stakeholders on this. I certainly welcome feedback on legislation, as I do for all bills that I put forward. So I think it's too early to say where different stakeholders are, but I'm really optimistic. I think this is common sense.
I think there is not just common sense, but there's common ground in between the two.
Absolutely.
And if we can sit down and talk about it, I think that we're going to be okay.
Absolutely, and I think this bill in particular, again, there are thornier issues when it comes to police reform.
Right.
This is, I think, more straightforward because we're literally talking about people who've been convicted of a crime, and specifically convicted of the crime of abuse of power. Official misconduct is what it's called.
Okay.
And I think there's common ground very much on this issue.
I think there is too. So I cannot let this go. Right, we talked about this a little bit. We have a lot going on right now in the country in regards to transgender, especially the comments made by Dave Chappelle in his recent routine. And although comedy is comedy, there's lines. There are definite lines there, and I cannot let this interview go by without trying to get your opinion on that.
So, you know, what I'll say is I think good comedy is comedy that challenges those in power and pushes the envelope. Good comedy punches up, it doesn't punch down. I think it's easy to punch down, right? And punching down is what we see bullies do. In a school, we see bullies under the guise of jokes, punching down, bullying people. I think comedy that punches down too often, frankly, is actually just bullying dressed up as comedy. Also, you know, when it comes to the Dave Chappelle situation, good comedy, like I said, pushes the envelope. This doesn't push the envelope. People have been making fun of trans people for decades, right? This is not new. This is not innovative approach to comedy. This is just taking the same, frankly, dangerous tropes that have long existed in our society and putting it in a special. So it's nothing new. It doesn't push the envelope. So in my mind, it can't be defended as good or innovative comedy that challenges those in authority. Reality is it's bullying, dressed up as comedy on a stage, and it causes real pain for people who are already facing a lot of challenges in their own life. And I just think that ultimately, if the question is, should we have more kindness in our society? The answer should be yes.
Outstanding. I knew I was asking the right person. Another thing, quickly, something that we've already talked about. I'm vaccinated.
Yeah.
You're vaccinated.
Yes.
What would you say to those folks out there who are not, that are on the edge of getting vaccinated?
Well, you know, I think there are a number of different reasons why people might be hesitant. And there's reasons that are based in misinformation. There are reasons based on barriers, right? There are folks who are concerned about the side effects of the vaccine and they don't have the ability to take time off should they have that side effect, right? So there are different reasons why people are hesitant. But what I would say is that the science is clear, the data is clear. These vaccines work. They are effective. And they're not just effective for us, but they do help to reduce the transmission. And so if you're not getting vaccinated for yourself, do get vaccinated for someone who might be more at risk, including vaccinated people who may be at risk with serious health conditions. Because if we all get vaccinated, transmissions go down. And ultimately, we can help reopen our economy more fully.
We can get over this.
We can get through this.
Yeah.
And so even if you're not doing it for yourself, we need people to get vaccinated for our communities, for our economies, for our economy, for one another. And at the same time, we need to continue to explore ways to make the vaccines as accessible as possible, to break down any of those barriers that might cause a person who even wants to get vaccinated to say, you know what, I'm just not willing to give up a day's wage in order to get vaccinated. That should never be the choice, which is why the president's moved forward with required paid sick time for businesses with 100 employees or more when it comes to the vaccine. And I think we should figure out how we can help lift up people and support people who work for businesses under 100 employees.
Again, I knew I was speaking to the right person. And you guys just thought it was me urging for a vaccination. No, you can't do it for yourself, do it for a loved one. As always, Senator McBride, thank you for being on the agenda, and we look forward to seeing you again.
Thanks for having me.
This week on the agenda, we've covered a lot. Everything from fuel prices, global economy, paid medical leave, and reviewing the Build Back Better bill, and how we're running parallel programs right here in the state of Delaware to ensure that you are covered. Frankly, you're on the agenda. Now, what are we going to do about $4 a gallon gas prices? Ms. Tidwell has her ideas. I have my ideas. Regardless, I will ensure that your topics are on the agenda. We look forward to seeing you next week on the agenda.